Welcome to Climate Change and Health in Small Island Developing States focused on the Caribbean. If you require translation into Spanish or French, please use the link posted in the chat and choose your desired language at the bottom of the Zoom screen. You should continue to keep this browser open as well to utilize the chat and Q&A features. Please be sure to scroll down and mute the video. Please use the Q&A feature to submit any questions for the panelists. This session is being recorded. Thank you.
You can go ahead and get started.
So James is supposed to go first, not me.
Good morning, good afternoon, buenos dias, bonjour, guten Morgen. Welcome to the closing ceremony of the Conference on Climate Change and Health in Small Island Developing States, focused on the Caribbean, which has been going on this week since Tuesday. My name is James Hospitalis, founder of Earth Medic and Earth Nurse, and I will be co-moderating this session with my conference co-chair, Professor Robert Dubrow, head of the Climate Change and Health Center at Yale University. When I demitted office as director of the Caribbean Public Health Agency 2 years ago, my relatives encouraged me to retire and enjoy life. But I could not retire knowing what I knew about the climate crisis, hence the founding of Earth Medic and Earth Nurse, about which I'll say a bit at the end. About our conference, even though we were sandwiched between the Caribbean Agri-Food Summit and the UNCTAD, the conference had over 1,200 registered participants from over 20 countries, including youth, indigenous people, public and private sector, civil society, and academia. I believe this conference will be seen as a milestone in addressing the climate and health crisis in small island states in the Caribbean, building on earlier efforts in the region. We have had a feast of information from the opening, where Prime Minister Harris spoke as the lead head for CARICOM for Health, and the must-see keynote address by Professor Michael Taylor, the scientific sessions on the impact of climate change on health, the immediate health benefits of climate action, the role of the health sector in addressing the crisis, and today we've been looking at how we put it all together: participation, representation, communication, and integration. Beside the science, we've had special events on engaging youth, which focused on how to integrate climate change in the curricula of secondary schools and medical schools, on multi-sector action and the opportunities and challenges therein, and last evening on public-private partnerships for climate action, which were rich in suggestions for pointing the way to win-win-win outcomes for people, planet, and business. We also had a couple of special events on the role of public health institutions in addressing the climate crisis, and a briefing on health in the COP26 taking place next month, organized by Public Health England, the UK Health Security Agency. If you did not get to a particular session, please note all the sessions are available for your free viewing for 1 month afterwards. We will also be putting all the recordings on our website at Earth Medic and Earth Nurse and at key partners to facilitate access. Now, some of the common messages across the sessions related to implementation gaps and on joining up silos. A frank comment from youth activist Priyanka Lala at the opening really caught my attention. She said, all the data is useless unless it gets into the hands of those who need to know and act, including the youth. Let me thank and recognize the core group of Yale, Emory, University West Indies, Pan American Health, and over 25 key partners that have made this conference possible. Countries and institutions that participated range from Suriname, Guyana, and Belize on the mainland, the English-speaking islands, Cuba, the Dominican Republic, Puerto Rico, and beyond, as far as Australia, Myanmar, and Rwanda. I was so pleased to see Caribbean Agriculture Research and Development Institute, SEDIMA, CIMH, the OECS Secretariat, the Conference of Churches, and we had our CARICOM Secretary General, Dr. Carla Barnett, especially focusing on the youth to open the youth session. We also had Public Health England, Santé Publique Française, and the Dutch Public Health Agency. Now, one always runs a risk in naming institutions, and some get left out, for which I apologize. In addition to the conference key partners, very pleased to see international partners, the Global Climate and Health Alliance, George Mason University, and partners from the private sector, Caribbean Hotel and Tourism Association, the Guardian Group, Chamber of Commerce, Digital Technologies. Again, I probably left out some, for which I apologize. Let me turn to the way forward and some of the next steps and commitments of EarthMedic. As a civil society organization, and in collaboration with key partners, we will be acting in 4 areas. First, advocacy. We want to design and deliver a climate and health roadshow to take the message to countries to speak to head, to heart, and to pocket. We did this for HIV/AIDS in the late 90s and early 2000s to 12 cabinets and parliaments. We want to advocate for the inclusion of climate change in medical school curricula. And I'm very pleased to announce the commitment of Dean Cecil Boston from the University of Guyana, which is a very climate vulnerable country, for EarthMedic to address the entire incoming class on climate change and the role of health professionals, October 19th at 1 p.m. Advocacy, we're also going to be advocating for health warning labels on fossil fuel pumps, led by Doctors for Extinction Rebellion in the UK. Why? Because the continued use of fossil fuels is destroying our future. Our only hope of staying well below 2 degrees centigrade and perhaps hitting the 1.5 degree target is to leave a lot of the fossil fuels in the ground. That's a tough message, especially for a petrostate like Trinidad and Tobago, where I'm based. Second area is dissemination of information. And I'd like to mention 2 things. I'm very pleased to announce the commitment of Jared Granado, General Secretary of the Caribbean Conference of Churches, to disseminate through their channels information on climate and health and to integrate this into their school system and into the training of the clergy. Secondly, I'm very pleased to announce the commitment of David Roberts, Chief Executive Officer of Trinidad and Tobago Television, the oldest TV station in Trinidad, to be a media partner in climate and health and to run a series on climate change and health in the coming months. Third area is professional development of health professionals, especially in climate and health education and in the skills needed to join up the silos, health diplomacy, negotiation, and partnership skills. It's a priority also for EarthMedic and EarthNurse to do some knowledge, attitude, and practice studies of health professionals, nurses, and doctors. And we intend to start with the Trinidad and Tobago Medical Association, the Trinidad and Tobago Registered Nurses Association, University of Guyana, and St. George's University. Finally, in partnership and collaboration, we commit to partner with all sectors, including the private sector. And I'm happy to announce the personal commitment of Ravi Tiwari, the Chief Executive Officer of the Guardian Group, to be a champion for action on climate change and health. Let me now wind up by sharing a few slides on EarthMedic and EarthNurse, and then I'll introduce Professor Robert Dubrow. Can I have a slide, please? EarthMedic and EarthNurse was founded, launched last year as an NGO focused on mobilizing health professionals to address the climate and health crisis. Our first major venture has been this conference with all partners. If you look at our logo, you see that the earth is symbolized by the first aid symbol, and it's surrounded by a turbulent hurricane of change. Next. These are all the conference partners. Over 25 partners have joined forces, unprecedented in the response to climate and health crisis. Next. So the conference have heard that patient Earth is sick and that this constitutes a health crisis. Next. Next slide. Who is EarthMedic and EarthNurse? Well, we're striving to become the trusted advocate for improving planetary health conditions. Our priorities are SDG number 3 on health, particularly non-communicable diseases, SDG number 13, climate, and SDG 17, partnership. We partner by taking account not only of our own interests, but the interests of others. However, there are some that we cannot partner with. The tobacco industry, which King James 500 years ago deemed a vile habit, and fossil fuel industry. As I've already mentioned, the continued use of fossil fuels is destroying our future. Our top priority is the mobilization of health professionals worldwide. We're not-for-profit, global in scope, and we're anchored in the Caribbean, SIDS. Next. Our prayer, may God give us the grace to come together in one accord to care for all that he has created. Next. Our board of directors includes myself, Dr. Christopher Newman from the UK, Nurse Margaret Fay from the UK, Professor Maureen Lickfeld, the Dean of the Graduate School of Public Health at the University of Pittsburgh, and Dr. David Johnson, Dominica. Next. We invite you to join us. We have a very short 15-second pledge for busy health professionals. If you're a nurse or a medic, you can take this on our website. Next. And there's the sign-up form. And next, a very short 15-second video of a nurse from Trinidad taking the pledge. Can you?
I am a nurse. Climate change is a health crisis, a push for the world to start anew. I pledge to improve my health, our society, and my planet. I am a nurse.
Next. Thank you very much. So now I'd just like to quickly introduce Professor Robert Dubrow, who has been a great partner and co-conference chair. Over to you, Robert.
Okay, thank you, James. Working with you, the coordinating group, and the larger steering committee to bring this conference to fruition has been one of the most fulfilling and stressful experiences of my life. I see it as a model of South-North, North-South solidarity, with the South and North working respectfully together as equal partners and with all welcomed and no one excluded. I'm particularly grateful that you and I have become friends, James. I've learned so much from your wisdom, strong moral compass, enthusiasm, openness, gentle feedback when I missed the mark, and vast knowledge of health issues in the region. I'd like to highlight three critical themes that we need to keep in our sights going forward. The first theme is South-North, North-South solidarity. Being from the North, I'll focus on what we in the North need to do. As has been pointed out many times, most anthropogenic greenhouse gas emissions have been emitted from the North. But the people hit hardest by the climate crisis live in the South, with small island developing states perhaps having the most to lose. Nevertheless, we are in the midst of a global emergency that nobody, North or South, will ultimately be able to escape if we don't take drastic action. The climate crisis is a global problem that requires global solutions. We can only solve this problem together. We in the North, including the Yale Center on Climate Change and Health, have an obligation to take the lead on mitigation by forcing our governments to do what they should have done 30 years ago, reduce greenhouse gas emissions with all deliberate speed. We in the North also need to pressure our governments to provide adequate financing for mitigation and adaptation in the global South. Finally, we in the North need to support frontline regions in the global South to amplify your voices for climate action. This conference in particular has helped to amplify the voice of the Caribbean region for climate action on health. The second theme that I think we need to keep in mind is that we need to respect and honor those we lose due to the climate crisis. For example, the official death toll for Hurricane Maria in Puerto Rico was 64, until two research studies showed that the real death toll was 3,000 or greater, when excess deaths in the weeks and months after the hurricane were taken into account. However, most climate-driven extreme events are not studied in this way. We need research that documents the full health toll inflicted by the climate crisis. Just like African Americans in the United States murdered by police should not be forgotten and should not remain nameless, people in the Caribbean and elsewhere killed by climate change-driven hurricanes, heat waves, droughts, floods, or wildfires should not be forgotten and should not remain nameless. No matter what their station in life, whether a homeless person in Jamaica, an indigenous person in Suriname, an elderly person living with diabetes in Cuba, or a child displaced by a hurricane in Haiti, their cause of death, if climate change induced, should not be swept under the rug. We owe it to them and their loved ones to specify their true cause of death and to, quote, say their names, figuratively, if not literally. We researchers must serve as witnesses. It is a sign of respect, and importantly, it also documents the true human cost of the climate crisis for the general public and policymakers. The third important theme is implement now. I myself am an epidemiologist. I'm a researcher. One of our favorite slogans is more research is needed. And much important research, like documenting the full toll of extreme events, as well as research in many other realms, is indeed needed. However, we cannot use the need for research as an excuse for not implementing. We know we need to install solar panels on the roofs of hospitals. We know we need to build bicycle lanes and walking paths and to plant trees in cities. We know we need to institute climate smart agriculture. It's a question of political will, financing, and multi-sectoral cooperation. To optimize the quality of implementation, a high priority should be given to integrating implementation research into implementation projects. There's much work to do. The Yale Center on Climate Change and Health is committed to continuing its work with partners in the Caribbean and to helping carry out the research and implementation agenda emerging from this conference. We will work tirelessly to do so. Okay, so now let me introduce our next speaker, who is Ms. Teresa Turner-Jones. A national of the Bahamas, she is General Manager of the Country Department Caribbean Group, which oversees the Inter-American Development Bank's operations in Barbados, Guyana, Jamaica, Suriname, the Panamas, and Trinidad and Tobago. While serving in this position, she continues to carry out the functions of country representative for Jamaica. Ms. Turner-Jones has over 20 years of experience in macroeconomics and economic development, with particular emphasis on the Caribbean. She has held key positions in the International Monetary Fund and in the Central Bank of the Bahamas. Ms. Turner-Jones' vision is that the Inter-American Development Bank will continue to strive to improve lives in the Caribbean by creating vibrant economies where people are safe, productive, and happy. So now, Ms. Turner-Jones.
On behalf of the Inter-American Development Bank, we're very pleased to support this conference on health and climate change and congratulate the various organizations involved. We're also pleased that we have had the opportunity to highlight the work of the regional track of the pilot program for climate resilience, PPCR, and its activities related to the health sector. It's also very timely that we have this conference given the growing existential threat of climate change, particularly to the Latin American and Caribbean region and other highly vulnerable regions globally, although I would say that all countries in the world are threatened by climate change. Obviously, small countries are more threatened than larger ones. I'm sure that most of the topics discussed during this conference and the tangible areas of interventions proposed to address this issue will provide a strong scientific basis and platform for Caribbean countries to engage in meaningful dialogue at the upcoming COP26 meeting in Glasgow. We are well aware of the importance of the meeting, given the continuing rise in global temperatures and the urgencies to hold these temperatures at a sustainable level of 1.5 degrees Celsius. The extreme flooding events We're seeing in Europe the devastating wildfires in the US and Canada and in Russia demonstrate that no place or country is immune to impacts of climate change, and that we're all in this together. The IDB recognizes the urgent need to address the impacts of climate change, and we are committed to supporting member countries in LAC in their efforts to address the impacts of climate change. We have made this commitment especially taking into consideration the smaller members in the region, and of course, Caribbean features and Central America as the two regions that are most vulnerable. For this reason, we launched Vision 2025, Reinvest in the Americas, a Decade of Opportunity, which builds on our long-standing efforts in development in the region, including that of advancing the climate change agenda in LAC. There is a strong emphasis on building resilience to climate change, and we will provide investments to help build that resilience to climate-induced increases in sea level, storm intensity and frequency, heat stress, water shortages, agricultural losses, and disease outbreaks, all of which have enormous costs. It is estimated that some 2.5 million jobs in Latin America and the Caribbean could be lost just to heat stress alone by 2030. This is an ILO estimate. So we see the future investments in how we build, how we undertake sustainable land practices, how we maintain our biodiversity in a sustainable manner, and of course, how we can boost GDP and employment while recovering from the current COVID-19 crisis. During this conference, you will discuss many of the implications and possible solutions, which we'll have taken note of and will discuss with our partners, both public and private, in our member countries. I also want to highlight that it will focus on the provision of knowledge and expansion of innovation to advance the agenda on climate change, in the health sector, of course, and also within other sectors, given the interrelation between them. The need to effectively disseminate and sensitize stakeholders, decision makers, communities, investors, everyone, in the importance of climate change and the appropriate and timely responses will be key to our efforts. Additionally, there is need to advance innovation, especially of technologies and approaches, in order to quickly and cost-effectively reduce capacity gaps, improve efficiency, and improve inclusion. COVID-19 experience has taught us a lot, especially in exposing the fragilities within our societies, and provided significant lessons and insight of what will be urgently needed for an effective response to the global challenge of climate change. We're also examining this issue through a regional lens and have initiated in the Caribbean the Build Forward initiative that has a strong emphasis on smart and resilient investments, given the reality of extreme vulnerability of the region to the impacts of climate change. The economic recovery from COVID-19 must be done in a sustainable and resilient manner that involves green and blue infrastructure, innovative financing measures, and that are inclusive and lowers inequality. In November, COP26 will take place with the theme of uniting the world to tackle climate change and having among its goals adapt to protect communities and natural habitats, mobilizing finance, and working together to deliver. We know the health sector is embedded within these goals, and we hope that the discussions that took place today and during this conference will help provide and highlight this connection between health and climate change and advance discourse and provide advice on essential interventions that are critically needed at this stage. Once again, I want to congratulate the organizers for the hosting of the conference, bringing together this vast array of presenters and discussants on the various facets of climate change and health. This is a very important moment for the region, and we need to rise to the occasion. Thank you very much.
We just heard from IADB, Therese Turner-Jones. Allow me now to introduce Professor Robert Dubrow, who will co-moderate the rest. Oops. I made a mistake.
Yeah, I think, let me take over, James.
Okay.
Yeah, so I'll wait for you to get off and. Okay. Hi, everyone, again. So thank you, Ms. Turner-Jones. And now it'll be my pleasure to introduce Professor Rosemarie Bell Antoine, who is the Pro Vice Chancellor, Graduate Studies and Research at the University of the West Indies. She is also Professor of Labor Law and Offshore Financial Law and former Dean of Law. Pro Vice Chancellor Antoine is an award-winning scholar who holds a doctorate from Oxford, an LLM from Cambridge, and an LLB from the University of the West Indies. She is an international legal consultant who has authored varied influential reports for several international organizations and governments, including on environmental rights and health. She was president of the Inter-American Commission on Human Rights and the inaugural head of the Organization of American States Economic, Social, and Cultural Rights Unit and rapporteur for Indigenous Peoples. Professor Antoine.
Good afternoon. I really thank the many organizers of this wonderful conference and proud that UE is among them. And I want to thank you also for inviting me to give these remarks. I've been very fortunate to have listened to several of the sessions. And although my background is law and not science, I was able to follow. And indeed, this is as it should be, because after all, the issue of climate change and health concerns each one of us. In fact, that's one of the biggest takeaways from this conference for me. It is absolutely imperative for us all to bring the science to the people. That's the only way we can make a genuinely positive impact and not just help to save the planet, but protect our health. Of course, it's vital that we develop a comprehensive research agenda to persuade and inform our policymakers. And I'm proud to say that the UE has ably contributed to this goal. We will continue to be pioneers and leaders in research and education on climate change, including its health deficits, such as our work on climate change and mosquito disease. For example, our newly formed Climate Change Institute is also poised to expand the work needed in this now much more focused thrust. But quality research, even research fueled by policy objectives, will not be impactful if the average citizen does not identify with it, experience it, believe in it. Despite the decades of information from our scientists warning us about the dangers of climate change, it has made very little difference to the way the average Caribbean person lives her life. When we add the dimension of health to climate change, the silence and apathy is even more deafening. To the average person affected by climate change, it remains invisibilized. I imagine myself as a young male suffering from asthma. While lying, I'm bitten by a mosquito and I get dengue, then my house floods. I go skipping in the waters and fall ill with leptospirosis. My family is displaced by a mudslide because as a squatter, I evaded planning. In any event, everyone here clears all the land when building. No one wants to take care of trees, so they can't take care of us. I have a weak immune system because of poor nutrition caused by leached soil and diminished quality food crops. And at the hospital, my recovery is compromised because of power outages, too many ACs putting pressures on the grid, and the list goes on. So how do we make the man and woman on the street, in the supermarket, when there's no water or dirty waters in our pipes? How do we help them to understand, to make these connections, to recognize that when we abuse our climate and our environment, it has both direct and indirect impacts on our health? Not just health, poor climate change practices also have negative outcomes on our economies and our incomes, poverty and increasing social inequities, are outputs of climate change too, leading to even greater vulnerabilities and health risks, reducing our capacity to negotiate best practice health outcomes, as we saw with COVID-19. We must empower our Caribbean citizens to make the right choices. This is a key priority for us here at the UE. It requires an activist approach to the science. It requires research from the ground up, involving those who deal with climate change every day, such as the farmers, noticing different plant cycles and clamoring for support to develop natural-based feed instead of chemicals and greener production. As the Pro Vice Chancellor spearheading research priorities, I am convinced more than ever that our direction and our solutions must be interdisciplinary and collaborative. Quite apart from the necessary new laws, there's work to be done by lawyers on climate justice, given what we already know, that it is the most vulnerable and underserved in our communities who are likely to suffer most with negative climate changes. We must be part of the movement to concretizing economic, social, and cultural rights to the environment, the right to water, the right to health, still seen by many as esoteric. This in itself requires research and progressive action from our social scientists as well. Our economists, planners, and policymakers must also be part of this new vision, spearheading initiatives such as industry linkages with farmers and conceptualizing tax incentives for green agriculture and lifestyles. I recall, for example, how long ago Barbados introduced tax benefits for solar systems. Health is a social construct as much as it is a purely clinical phenomenon. So it is imperative that we go beyond the clinical model of health. We must make the connections, calculate the costs, write the laws, lobby. All of the voices need to be on board. The lessons of our history and our heritage must also inform contemporary culture and attitudes toward climate change problems. Many of us remember our grandparents' houses with their elegant jalousies and the natural ventilation which cooled us, reducing the need for ACs. Modern versions are rooftop gardens, community gardens, and so on, which have done so well elsewhere. Quoting Professor Michelle Maiku in one of the presentations, we must relearn how to design with nature. So I think we need to recapture our climate-sensitive architecture as we move forward to green our cities and spaces, and it is a collaborative effort. And of course, the UE has an important part to play in forging these partnerships, at the same time incorporating sustainable finance and technological mechanisms to fund them. I hope that in the collaborations that we absolutely must make, that we do not only rely on the corporate sector and the governments. We have a rich resource in our indigenous communities who respect the earth as part of their culture and religion, so we must use them. Yes, we did very little to create this threat to humanity, given our small carbon footprint, but we have a disproportionately big role in relation to our size to play in alleviating it. We, the small island states in the Caribbean, are victims of climate change abuses which impairs our health, but we cannot and will not be trapped in victimhood. Rather, we must be the empowered in this struggle, the thought leaders, the pioneers, the power brokers that can lead the world. The UE is already an institution punching way above its weight, now in the top 1.5% of universities in the world. We hold a very special advantage in contributing to this whole initiative. We, of course, will continue with the structures and programs that we've put in place, some of which were involved in this conference, and we will continue to close the gaps that exist, not only in research and funding, but also in our curricula, teaching and learning objectives. We have lots of courses on climate change, but we are developing one, for example, a core course on climate change and health. Our intellectuals, our scientists, our researchers must also punch way above their weight in shaping and implementing action-focused research, bringing concrete solutions, not just for the region, but for the world. I pledge to you that the University of the West Indies, the UE, will be at the forefront of that movement. And as Pro-Vice Chancellor for Research, I commit to the fullest support to ensure success for the objectives so ably highlighted in this conference. Thank you.
Thank you, Professor Antoine, for a very grounded presentation. I'd like to introduce next our speaker, Dean Chambliss, from the Pan American Health Organization, who is responsible for the Office of Caribbean Program Coordination in Barbados. I first met Dean, not sure how many years ago, in Geneva, and I was always impressed at his management skills and his people skills and his ability to collaborate. Dean, over to you.
Thank you very much, James. Yes, it has been too many years to remember. But thank you very much for that kind introduction. Good afternoon. I'd like to thank both James and Dr. Dubrow for the invitation to address this seminal event. Many organizations and individuals have been involved in the planning and execution of this conference. It has featured a remarkable lineup of speakers from across the Caribbean, highlighting the multi-sectoral approach that is critical to addressing the broad spectrum of climate and health issues that we face in this region. It is a great pleasure for the PAHO team and for me to have been part of this conference. The Caribbean is home to 28 small island developing states, or SIDS, with over 40 million inhabitants. Pre-COVID-19, this region also welcomed millions of tourists each year. The Caribbean is highly reliant on its environment and climate, which are linked to its ability to entice visitors, produce its own food, and enjoy life. Outdoor living and work are vital to the Caribbean. However, as has been highlighted this week, Caribbean SIDS are already suffering the consequence of rising sea levels, more variable weather patterns, hotter days and nights, warmer seas, more extreme hurricanes, and for many, dwindling supplies of potable water due to periods of drought. Several panelists have highlighted the direct and indirect ways in which climate change impacts the health of the Caribbean people. These changes will be unprecedented, making our agreed upon actions this week a critical opportunity to tackle this threat in a coherent and united fashion. The existing gaps in Caribbean climate and health research and implementation, as well as approaches to reach existing and future vulnerable populations adversely affected by climate change, have been common themes this week. As the Caribbean continues to experience the strong adverse effects of global climate change, with serious implications for our health and well-being, this conference comes at a crucial time. One immediate success of this conference is the wide array of perspectives presented from public and private sectors, the inclusion of civil society and the indigenous community, to name just a few. The health and non-health sectors present this week have a shared responsibility for prevention and preparedness. The health sector has a critical role in addressing climate change and health through promoting sound adaptation and mitigation tools. In the words of Dr. Michael Taylor, the health sector needs more mitigation champions in the Caribbean, as the co-benefits bring extraordinary value. Indeed, the multi-sectoral approach in this conference has effectively demonstrated the interconnected nature of health, environment, climate change, and economic prosperity. Over the past 20 years, PAHO has played a significant role in addressing the health implications from climate change in the Caribbean. More recently, the development of the Caribbean Action Plan on Health and Climate Change, as well as the current projects with the European Union and the Green Climate Fund, are aligned with many of the recommendations generated this week. Among these commitments are empowerment of climate and health leadership, engagement in generating evidence, mainstreaming health and the climate mitigation and adaptation agenda, and understanding the immediate and significant health benefits from reductions in emissions. Climate resilient health facilities are now more in demand than ever to withstand disasters and serve as low carbon models. The PAHO Smart Healthcare Facilities project in the Caribbean is currently transitioning to a movement that engages multiple partners and shortly will reach a milestone of 55 smart healthcare facilities in 7 countries. PAHO is committed to continue our work with CARICOM and partner organizations to empower health leadership to engage nationally and internationally, in order to support research to better understand the impacts on health, to better prepare by establishing climate-resilient health systems, and to facilitate access to climate and health financing. This conference represents a crucial step toward the 2030 vision of Caribbean health systems that are resilient to climate variability and change. PAHO will continue to support Caribbean countries in their forthcoming United Nations Climate Change Conference, COP26, commitments to develop climate resilient and sustainable low carbon health systems. In closing, I'd like to congratulate the organizers for their emphasis on an inclusive conference, for highlighting this region and creating this shared vision. The findings and recommendations from this conference will ensure the development of a strong research and implementation agenda in the months and years to come. The world is looking to Caribbean leadership among small island developing states as we strive for a resilient and healthy future in the face of the dramatic effects of climate change. In the face of this adversity, PAHO is and will continue to be a dedicated partner to Caribbean member states and institutions as they seek to improve health and economic prosperity. Thank you very much.
Thank you very much, Dean. From that perspective, from the Pan American Health Organization, we've enjoyed working with your office, particularly through Jonathan Drury. I would now like to introduce our final panelist, Baroness Scotland, who is the first female Secretary General of the Commonwealth Secretariat. Baroness Scotland is from Dominica, one of the most climate vulnerable countries in the Caribbean. She is a lawyer and a politician. She was elevated to the House of Lords in 1997, and as a British Labour Party politician has served in a number of ministerial positions. Let's hear from Baroness Scotland.
Greetings, everyone. It is good to have this opportunity of sharing with you some Commonwealth perspectives on the important topic of climate change and health, particularly in the context of small island developing states and the Caribbean. Such focus is of immense importance for the Commonwealth collectively and for me personally. Climate change is the defining challenge of our age, which, as the recent IPCC report has made clear, is a direct result of human activities. Although a global phenomenon, there are identifiable local and regional consequences. Amongst these are the increased intensity and frequency of hurricanes in the Caribbean, rising sea levels in the Pacific, desertification and more frequent droughts in Africa, flash floods and extreme temperatures in Europe and Asia, resulting in real harm to lives and livelihoods. Whilst small island states, including those in the Caribbean, have contributed least to the causes of climate change, they tend to suffer more from its consequences, making the climate emergency not only a planetary health issue, but also a justice issue. Combined with other factors such as biodiversity loss, land degradation, and the global COVID-19 pandemic, the impacts of climate change on health and on life more general are far-reaching and pervasive. For example, climate disaster results in direct human deaths, injuries, illness, and mental strain and distress, which add to the pressure on the health systems. Similarly, cases of vector, food, waterborne, and non-communicable diseases are often climate sensitive and known to increase. Dengue, malaria, and diarrheal diseases are examples of this. The World Health Organization estimates worldwide between 2030 and 2050 an additional 250,000 deaths per year will occur as a result of climate change impacts. Higher temperatures are correlated to dehydration, renal functional loss, dermatological malignancies, tropical infections, pregnancy complications, allergies, and cardiovascular and pulmonary diseases and mortality. The impact of climate change on water availability for food production means that climate change casts a shadow on nutrition. Figures from FAO, IFAD, and WFP indicate that between 2014 and 2016, 20% of the population of the Caribbean is. While food security in the region has in general been improving, climate-induced disasters retard progress and increase negative impacts. Through Commonwealth convening power and multiple networks of connection and cooperation, we are helping to mobilize progress towards ambitious climate commitments at COP26. Within support for the health sector, there needs to be action on short-lived climate pollutants, such as methane, black carbon, and ozone, which are clear health hazards. Advanced economies are the major emitters of greenhouse gases, and it's vital that they deliver on the $100 billion per year commitment to assist developing countries, including SIDS in the Caribbean, with mitigation and adaptation. For example, by building more resilient health systems. Our Commonwealth Finance Access Hub is helping to release such vital finance to Commonwealth nations, amongst them Antigua and Barbados, and Jamaica. As of July 2021, 32 projects in 6 countries, totaling $44.1 million USD, have been mobilized through support from the hub, with a further $762 million worth of projects in the pipeline. More of these resources need to be channeled towards the health sector, and the Commonwealth Secretariat is at an advanced stage of finalizing a memorandum of understanding with the World Health Organization to strengthen engagement alongside our member governments on averting and managing climate health risks. Within our planning for a green recovery from many consequences of COVID-19, we are working to encourage greater use of off-grid clean energy, as more sustainable solutions for the cold chains need to be store vital drugs and vaccines. It is important also to consider soil, water, and other environmental determinants of health. The proposed Commonwealth call to action on living lands, which is currently being considered by our member governments, is designed to accelerate coordinated action to leverage synergies between biodiversity, climate, and land. Such linkages are key for land systems adaptation to climate risks within national adaptation plans. Through these and many other interventions, the Commonwealth Secretariat is working alongside the member nations we serve collectively and individually in accordance with the values and principles of our Commonwealth Charter. In wishing you success for your conference, I assure you of the continuing active engagement of the Commonwealth Secretariat on these issues of such pressing concern to all our people.
Over to you, Robert, now to close us off.
Okay, thank you, James. So first, I'd like to say to thank Baroness Scotland for her words, particularly given the SIDS in the Commonwealth in the Pacific, and we hope that ComSec can be a partner in future climate and health initiatives. So briefly, we're just about out of time, but first, I wanted to remind you that the conference website will be open to you for the next 30 days with a recording of each session available. In closing the conference, I look forward to working with all of you to build a world with a stable and safe climate in which human health and diverse ecosystems can thrive. Thank you. And this is the official close of the conference.
Bye, everybody.
Okay, bye, everyone.
A lovely meeting all of you, and I did enjoy the conference. Those I missed, I will go and look, make sure I go and catch up. I learned a lot too. Bye bye. Have a good weekend and stay safe.
Yeah, bye everyone.
Bye.